if we look here at the video, we can see the radial artery sitting middle of our screen here. From there, to find the median nerve, we're going to slide towards the middle of the forearm. And if we look down at about a 45-degree angle, we'll see the median nerve sitting right now in the middle of the screen. The median nerve we can identify, it has that anisotropy that we spoke about earlier. So it's reflective, it has that honeycomb type look. And then I'm going to sweep back and forth. When I'm exactly perpendicular to it, as I am now, it shows up quite nicely, but if I just come off just a little bit, you can see how it disappears. So we want to get the best possible view, and then from there you want to decide which direction you're going to come at the nerve from. So you can either come from the radial side or from the ulnar side to get that median nerve. For this block here, I think the ulnar nerve is a little bit farther away, so I'm just going to come in from the ulnar side because I think that's the ulnar artery is sitting way over here, and so that's more out of the way. So from there we're going to again come in line, and so if you follow my hand in here, feel a little bit of a poke here, my apologies. And then we can see the needle coming in through the screen here. And if I wiggle it just a bit, we can see it moving through. Once we get below that first fascial layer, inject a little bit of freezing. We can see it dissecting along that tissue plane. We can advance a little bit farther. If we lose the tip, just slide back and forth, or just wiggle it a little bit, and then we can see where we are. There we want to fill up that entire area, and we can see the fluid coming around the nerve. And so then from there, we're going to move the needle again. I'm going to come a little bit deeper this time. You can see it moving distal. And we see that fluid going all the way around the nerve. Once that's completed, take the needle out, and then within probably about 5 minutes we'll start to get some anesthetic effect. Again, we have the median nerve sitting in the middle of the screen, with that honeycomb type shape sitting right in that fascial plane. From there, we're going to slide towards the ulnar artery, which now we can see it's the black fluid-filled structure in the middle of the screen. And if we look just screen right of that ulnar artery, so on the ulnar side of the ulnar artery, we see the ulnar nerve. And so as I sweep through, you can see it has again that honeycomb look to it. And again, it's sitting in the tissue plane, which makes it easy to identify. It's a bit more superficial and a little bit easier to access than the median nerve. So again, we make sure we're away from the artery. We come in plane again. The needle comes in. Once we're just below the fascial plane, we start to inject. The fluid's going to fill around that nerve. You can get a little bit closer. So we can see that fluid dissecting both above and below the nerve. And then again, probably within about 10 minutes, 5-10 minutes, we'll start to see effect. Normally I would inject between 5 and 10 cc's of 1%. We can do it with or without epinephrine, and that should give you a pretty good effect. Depending on the injury, you may want to use something a little longer acting than the lidocaine, and bupivacaine will give you a bit of a longer effect if it's not just a quick procedure.